Privacy activists the world over may wince, but China makes no apologies for this, enforcing isolation and quarantine in ways the West cannot fathom. QR codes on phones that track a person's travel and health status and either clears them or prevents them from moving around.
It's my first time to come outside after the epidemic, but I already used the QR code several times and I think it's good.
And it was back in early February, which now feels like a long time ago, that China was leading the way in herding a population into compliance. This elderly woman in Inner Mongolia chased and chastised by a drone for not wearing a mask. Is any of this in the works for North America?
Lots of diseases.
There are doctors who wish it were, but also know it's harder here.
We could not do it here, and I don't think most democracies could do that. It's really about leadership, and it's about getting the people to understand the critical role they play in protecting their communities.
But look how tough that's been. This was a bar in Nashville, Tennessee, just this weekend. And a scene like that will make a man like this seethe. Dr. Eric Toner, whose office is surrounded with the tomes of doom, is with Johns Hopkins. He ran this simulation last fall of a new and deadly coronavirus, invited health and business officials from around the world to do a dry run of how a pandemic would impact the planet and what to do about it.
International travel has turned local epidemics into a pandemic spanning the globe.
Everything happening now in the real world, he says, happened in the simulation and right on anticipated schedule.
In your modeling, did you have a sense of an additional maybe mortality rate from non-COVID-19 related cases as a result of a pandemic?
It's probably reasonable to assume that the case fatality rate will double because of inability to access care.
Case fatality rate for anything?
Yeah, probably an equal number of people will die because they can't get treated for their heart attack or their stroke. You know, if you're having a heart attack, you need treatment right then. If you're having a stroke, you need immediate treatment. And if the hospital can't take you in for those conditions, then you're in a lot of trouble.
Consider that a warning. The strain on hospitals is the obsession that keeps mathematical modelers up at night.
If you were infected, on average, you would infect 2 to 3 new people, and each of those people would go on to infect 2 to 3 new people.
In Toronto, Ashley Chute has worked through the numbers for Ontario and the range of measures required to not just keep people healthy, but keep the hospitals functional. Everything from closing schools and restaurants to a total shutdown.
So the most effective is this one here, which is where you tell everybody in the population to effectively stay at home.
Like Italy. Like
Yeah.
you just tell
Yeah.
everybody, just
Exactly.
don't go to work,
Yeah.
don't go to school.
Yeah.
But it's not a straight line. The peaks of infection in her modeling suggest the need for total quarantine for a while, and when that happens, you see the dips in infection. So people go back to activity, and then the rate rises again, only to have citizens sent back home. This pattern repeats until the line flattens.
And so you can imagine that this would be incredibly disruptive.
And you have this strategy over the course of 2 years.
Exactly.
You're not talking, if everybody stays home for 2 weeks, we're done.
No.
That needs to sink in. We're all in for the long haul. But Dr. Toner says he's seen enough to believe there is hope beyond a vaccine.
We think that we're going to have treatments for COVID-19 in a matter of months. We're not going to have a vaccine for a year or two or more, but we probably are going to have some therapeutics, some drugs that can be beneficial. Those can move much more quickly than vaccines can.
And long term, where does this end? The math and the medicine say it ends when the whole planet has immunity, because either the whole planet has had the virus or the vaccine, period.
Once we get to nearly complete immunity, it'll continue to spread. And what we think will happen eventually is that this will become a childhood illness, like the other 4 strains of coronavirus that cause the common cold. This will probably become just yet another childhood illness.
One day, but not now. and not soon.